Hi, welcome back. So today we're going to talk about back to sport testing and how we utilize this machine right here, the BTE. Also, the program that we use in it is called the PrimusRS. And pretty much what we are going to talk about is how important this machine is for kids who are returning back to sport. Usually a knee injury, most involved would be the ACL. So the reason why we use this machine is to isometrically test the quad and hamstring on the involved side and the uninvolved side. So a patient would have them come in here, say I tore my right ACL, we would have to test the right leg first in this machine. So it would be all strapped in and whatnot. My knee would be about right here. We do 3 attempts one way, switch it around, do 3 attempts of the hamstring, and then we'd flip all the way around, seat all the way around, do the same thing on the right leg. Now, why do we do this? Why is this important? 12 weeks post-op ACL, you need to be within 80% strength of the involved leg versus the uninvolved, so you can return to running. That's one of the major things to prevent re-tear rate. And by the time you're returning to sport, usually from ACL at 9 months, you need to be within 5% strength. Along with other testing that we would do on turf, jumping, running, cutting, you have to test out within 5% of the opposite leg as well. But also with this machine you can do a lot of isokinetic strengthening, where you can focus on strengthening the quad and the hamstring. So that it is important that the person is getting strong as quick as they can within that 6 to 9 month frame time when working with someone who had an ACL injury. But that pretty much is a quick overview on the BTE and why we use this machine. We just recently tested someone today and they happen to be within that 5%, so they are returning back to sport playing basketball. So we have a lot of success with this, and the main reason why we use this is to prevent re-tear rate. Re-tear rate is, you don't want that to happen, so we use as much research as possible to make sure that does not happen. So thank you for taking the time to watch this video. We really appreciate it. And thank you, and we'll see you.